So hello everyone, welcome to today's session. Today's presenter is Dr. Divya Lakshmi, and topic of this presentation is physical activity has a stronger correlation with arterial stiffness than strength, balance, or BMI in an older population. So I would like to tell you about Dr. Divya Lakshmi. Dr. Divya Lakshmi Ramakrishna is a scientific content writer and team lead at Phoenix Life Sciences since 2 years, where she has gained experience in operational, managerial, and administrative roles along with scientific activities. She has an expertise to present the articles in required formats such as blogs, white papers, disease summary, descriptions, posters, reviews, etc. in various medical specialties with main focus on oncology. She is involved in enhancing the scientific research content collected from the wide spectrum of literature to reach the target audience like patients, healthcare professionals, clinicians, etc. Currently, she is actively involved in content creation of the clinical gene map projects. Presently, at Vedic Life Sciences, she is managing multiple teams such as content team, data execution team, and health analytics, and is successful in completing the deliverables from the teams through planning, task allocation, guidance, reviews, and approvals. She is also experienced in proofreading, editing, and reviewing of the documents written by other team members. Recently, she has played a major role in the initiation and execution of major projects related to healthcare monitoring of senior citizens and rural healthcare program. Now, I would like to request Dr. Divya Lakshmi to kindly start the presentation. Thank you.
Thank you, Shreya, for this elaborate introduction. So, good afternoon, everyone. Today, I'm presenting the topic of physical activity has a stronger correlation with arterial stiffness than the strength balance or the body mass index in an older population. The topic is selected from Aging and Longevity and the journal named Frontiers in Aging, published in the year 2023. This research has major impact on the aging and the risk of the cardiovascular diseases. Now, as we all are aware that the association of arterial stiffness is widespread with an array of various debilitating health conditions such as diabetes, hypertension, and the cardiovascular diseases, which in turn has an impact on the overall health of individuals. In older populations who are prone to increased arterial stiffness, regular physical activity is an essential component of the healthy aging. There is lack of research on the association between the physical activity and the health outcomes of the individual. Also, it is impossible to stop the natural process of aging. And there are various factors and various studies which say that this may help to slow the age associated increase in the arterial stiffness. This includes the reduction in sedentary lifestyle, and which has been highly associated with slowing down of the natural progression of age related stiffness of the arteries. Also, exercise plays a beneficial effect on the arterial stiffness and also the overall health of individuals. Now, more research is needed to understand the association of different types of fitness indices with the arterial stiffness. The present challenges of this study were to assess which health variables are more important for arterial health of the older population, and also to determine the physical activity levels and which health variable can predict the arterial stiffness in an older population, along with the correlation of the physical activity levels with the arterial stiffness. The objective of this research was to explore the relative importance of strength, balance, and the physical activity on the arterial stiffness in the older population. Coming to the methodology, the residents from various independent living retirement homes from 3 different villages, they were invited to participate in the present study The total number of participants were 95 and 15 were excluded because of the incomplete data sets. So the total number of participants were 80 in number. The inclusion criteria was in all the individuals were over the age of 65 years and they were living independently in their retirement homes. And the other inclusion criteria was that they were physically able to participate in all the fitness tests which was included in this study. And there was prior approval by the participant general practitioner. The exclusion criteria here included that the inability for them to attend the appointments, also on the advice of the individual's medical professional, they were excluded from the study. Now coming to the methodology, which included the participants' demographic and the frequencies of their risk factors, that is the age, the systolic diastolic pressure, the weight and the height was measured, which in turn measured the body mass index. The risk factors were also considered like smoking and history of cardiovascular disease, previous stroke, and also blood pressure and diabetes status. Now, every prospective participant was provided with a research information sheet and a written informed consent document and also the physical activity survey. The recruitment was finalized by arranging a time with the researcher via phone or email, and ethical approval was also taken from the local university's human ethics committee, and all the participants were provided written informed consent prior to the participation. Now, each testing appointment, it lasted for approximately 1 hour, and this included an oral review of the physical activity questionnaire and a general health questionnaire, the ALA physical activity survey, which mainly focuses on the older population. Then the arterial fitness measurement, that is the pulse wave velocity. Then the strength test, the balance test, and the cardiovascular fitness test. Now, all these tests were described and explained verbally and then demonstrated also to the participant prior to the completion by the participant. Now, this yearly physical activity survey was mainly used to gather information on the physical activity of the older population. It had 2 sections, and the first section examined the typical physical activity pattern over 1 week in the previous month. And the second part of the survey, the participants examined the physical activity over the previous month, and it was divided into vigorous, leisurely walking, moving, standing, and sitting. The arterial stiffness was measured using a sphygmocore XL device, which was validated against the tonometry-based sphygmocore XL device. And the direct method of measurement was used, which was as explained in the manual. Next was a 30-second sit-to-stand test, which provided a reasonably reliable and a valid indicator of the lower body strength of the participants. And for the hand grip strength test, a mechanical hand grip dynamometer was used, and it was placed in the hand of the participant with the elbow bent at a 90-degree angulation, and the participant's highest score from each hand. It was combined, and that determined their hand strength score. Now, balance test was also used to assess the balance using the 4-stage balance assessment. This was designed by the National Center for Injury Prevention and Control. Now, the cardiovascular fitness test was the 6-minute walk test. That is, the total length was measured, which was completed by the participant in 6 minutes. And all these were recorded. So coming to the results, there was a wide degree of variability between the participants from different villages, particularly regarding their age and the pulse wave velocity. And then the statistical analysis which were used here was the ANOVA and the Pearson's correlation. Now coming to the results, here is the table which shows the three villages named as A, B and C, and the differences in their age, pulse wave velocity, the systolic blood pressure and the body mass index, along with the risk factors between the residents of the different villages are displayed here, and the Pearson's correlation between the pulse wave velocity and the health variables. So according to these results, the results were interpreted both quantitatively using the p-values and qualitatively using the spreadsheets. And a multivariate regression was conducted on all the three groups of variables to describe the association and to model relationships that each set of dependent variables and covariates had with the pulse wave velocity. In model A, that is the first village, all the physical activity testing variables, they were entered and they were analyzed to determine their ability to predict the pulse wave velocity. And this explains 16% of the variance, and it was a significant predictor of pulse wave velocity. Whereas in model B, the regression was run on all the variables measured in model A, but also the BMI and the risk factors along with the systolic blood pressure, age were added. And in model B, it explained 50% of variance, and it was a significant predictor of the pulse wave velocity. In model C, the significant predictors from the previous regression results were analyzed in a multivariate regression analysis in order to determine the ability and strength. And model C explained 45% of variance, and this was significant predictor of pulse wave velocity. Now, as we see the result correlation here, the number of risk factors, the age, and the systolic blood pressure had strongly compatible inference, and thus they were more harmful. They had harmful effects on the pulse wave velocity. Whereas the physical activity, the 6-minute walk and sit to stand and the balance test, they had beneficial effects and they were moderately compatible. Whereas diastolic blood pressure, it was unclear. Coming to the discussion now, the key findings of this present study indicate that the risk factors such as older age, high systolic blood pressure, and a large number of health risk factors were the strongest predictors of higher pulse wave velocity. And previous studies indicate that BMI or body mass index is a poor predictor of arterial stiffness, as BMI is unable to differentiate between the fat and the lean mass. Therefore, as BMI is unable to differentiate between the fat and the lean mass, it is perhaps not surprising that it was not associated with arterial stiffness in the present study. Also, the present study showed that the grip strength had no effect on the pulse wave velocity, and sit to stand test was weakly compatible. And the weak to moderate relationship between the sit to stand and the balance test on the arterial health is possibly because of the nature of impact of the physical activity on the arterial walls. It has been hypothesized that short-term physical activity likely improves the arterial stiffness via improvement in the vasoconstrictor tone in the smooth muscle tissue, as well as the enhanced nitric oxide bioavailability, which in turn regulates the brachial artery elasticity. Conversely, the long-term regular physical activity appears to prevent the structural changes in the arterial walls, which relate to the covalent cross-linking between the long-lived proteins, that is collagen, and advanced glycation end products. Previous research suggests that there is at least some irreversible arterial damage that occurs in the individuals with multiple risk factors for arterial stiffness, such as advanced age diabetes, hypertension, hypercholesterolemia. And therefore, in those participants with one or more risk factors for cardiovascular disease, The beneficial effect of physical activity on the pulse wave velocity is not strong enough to overcome the damaging effect of the risk factors on the arterial walls, and therefore these offset the beneficial relationship between the physical activity and the pulse wave velocity. Now, the limitations of this study was each of the 3 villages which were recruited in this study had different participant profiles, and also this study took place over a year. Therefore, the participants were tested in different seasons of the year. So the seasonal changes may have impacted the participants' level of physical activity, and this in turn could have impacted the arterial stiffness. And one more very important factor was that the prevalence of comorbidities and polypharmacy in older adults, that is, multiple medications taken at the same time or simultaneously. So this investigation says that the potential for the synergistic and the antagonistic effects between the different drug classes is important in order to understand the broader drug interactions, which could have caused the limitations. That could have been one of the limitations which could have an impact on the arterial stiffness, indirect impact. Hence, to conclude, this study reinforces that the importance of habitual lifelong physical activity in maintaining the arterial health in an older population. Also, the adverse effect of high systolic blood pressure, increasing age, and overall number of cardiovascular risk factors has a stronger ability to predict the arterial stiffness in an older population than the fitness-based tests. Thus, improving the general physical activity, including walking capacity, may prove beneficial in improving the pulse wave velocity in an older population. The impact of this research is that regular physical activity throughout the lifespan, among others, will have larger impact on the pulse wave velocity in aging adults as well as other cardiovascular risk reduction strategies. Engaging in physical activities later in life will have a beneficial effect on the overall vascular health as well. Thank you. You can find me at divyalakshmi@renix.org.
So there is one question from Vijay. Were the participants on a common controlled diet?
No, there was no control group at all in this study.
I hope this answers your question, Vijay. There is another question from Nepal. Do the subjects have comorbidity and any cardio disease? Also, they are more female in group.
Can you please repeat the question, Shreya?
Do the subjects have comorbidity, any cardio disease? Also, there are more female in group.
Also, they are?
More female in group.
Yes. The comorbidities mainly included the cardiovascular diseases. And one more thing is the number of participants, females or women, were higher than the males or the men among the total number of participants in the study.
Okay, I hope this answers your question, Nepal. So, do anyone have more questions? So, I can't see any other questions. Thank you, Divya.
Yeah, thanks everyone for your patient hearing.
Yeah, can you move to next slide? Yeah. So, next presentation will be presented by Uma Pala, and the topic of the presentation will be lower adherence to Mediterranean diet is associated with high adiposity and community dwelling older adults. Result from the longevity checkup lookup 7+ project. You are requested to kindly follow set of guidelines. Thank you.